My name is Tracie Smith. I'm Senior Director of Communications and Engagement here at Thunder Bay Regional Health Sciences Centre, and I would like to begin by acknowledging that the land on which we gather this morning is the traditional territory of Fort William First Nation and the Ojibwe people. Well, it's a good morning. It is a historic morning for Northwestern Ontario. It's been a long and challenging 9 months as each of us cope with the COVID-19 pandemic in our own way. And as we look to entering a provincial lockdown, we certainly know that the battle is not yet won. But today, we are at the beginning of a new chapter, one that gives us cause to be hopeful. We're joined today by some of our partners and grateful to have them here today. And you will hear from them momentarily. First, though, to share some more details about today's historic announcement, I would like to introduce the President and CEO of Thunder Bay Regional Health Sciences Centre and CEO of Thunder Bay Regional Health Research Institute, Dr. Rhonda Crocker Ellacott.
Thanks very much, Tracie, and thank you all for coming today to share this important occasion with us all. Administering the first COVID-19 vaccine in Northwestern Ontario is certainly a turning point in the COVID-19 pandemic. Before we get into the details, let me first share with you, I would first and foremost like to acknowledge all of the frontline healthcare workers across our community and across our region. We know and see how hard our frontline healthcare workers are working to keep us all safe. We know all of our healthcare workers have families and obligations at home, yet they care for our patients, for their patients with undeniable professionalism, compassion, and such a strong work ethic. They inspire us. You inspire us. And from the bottom of our hearts, thank you. To the families who have suffered a loss during this pandemic, I am truly sorry for everything that you've had to go through. Today, however, we have our eyes on the future. We see hope, and hopefully resolution soon to come. In this initial phase, we will take the opportunity to provide vaccines to direct frontline healthcare workers in long-term care facilities in Thunder Bay. In addition, we will administer vaccines to those who will travel to remote communities in the far north as part of Thunder Bay Regional Health Sciences Centre's responsibilities to help support the next phase of the pandemic recovery. Planning is still in the early stages and logistics are still being worked out, and I'm sure you can appreciate how complex this process is. At this time, I would like to thank our partners. We have been working very closely with our partners through this process. I would like to thank our pandemic task force, led by Dr. Peter Boros. All of our team together have been working tirelessly to ensure that we're able to distribute this vaccine smoothly. I certainly appreciate the anxiety that many individuals may be feeling today. It's been a very long haul. We're not there yet, as Tracie said. We're close, but we're not there yet. So please, as we're coordinating vaccination across the Northwest, please take care over the holidays to continue with public health measures. Please be kind to one another, and please continue to support those who serve us at the front line. Thank you, and be safe.
Thank you very much, Rhonda. Those public health measures and all of the expertise in community-based, publicly funded immunization programs are led by the Thunder Bay District Health Unit, who is an essential partner in the COVID-19 vaccination rollout. The team there has been working tirelessly to provide support and guidance to our entire community. And leading them tirelessly is our next speaker, Dr. Janet DeMille, who is Medical Officer of Health, Thunder Bay District Health Unit. Janet.
Thank you very much, Tracie. And I think I'd like to echo really all the comments that Rhonda has already brought forward here today. I think that she's covered a lot of the key points. And I just want to acknowledge, though, how exciting a day that this is, that there's actually COVID-19 vaccine right here, right now, and it's going to be starting to be administered. This is going to be a longer rollout. But it is very exciting to see that frontline staff, healthcare workers, and particularly those in long-term care facilities that have been in many ways so devastated by this pandemic. It is exciting to see that the initial rollout to that particular population. So I want to thank Sean for being the first one to receive it today, and that's exciting. And I do want to acknowledge that there's other priority populations that's already been mentioned, including First Nations communities who are also at higher risk because of COVID-19. And it's really exciting to see the hospital playing a role in being able to provide vaccine or the initial rollout of the vaccine to support the immunization of those populations as well. So thank you very much for having me here to be part of this exciting day. This has been a long, drawn out journey to get here, and we still have a longer, many more times to go to get to the end of this pandemic, but this is an exciting milestone. So thank you very much.
Thank you so much, Dr. DeMille, and to your entire team at the Public Health Unit for the incredible work that they've been doing throughout this pandemic. Now, as you know, the province is focused on administering the vaccine first to the most vulnerable populations, which certainly includes direct patient care staff of long-term care facilities, and that will happen here in Thunder Bay. Our next speaker has dedicated the last several months to the protection of long-term care residents and staff, and it is my pleasure to now introduce Tracie Buckler, who is President and CEO of St. Joseph's Care Group. Tracie.
Thanks, Tracie. Good morning, everyone. It's always hard to be the last one out of the speakers because a whole lot has been said already, but I certainly want to reinforce the importance and significance of today. It's something that we've been waiting for a very long time. It's something that will give our residents of long-term care homes, their families, and our staff, our frontline staff, a lot of hope for the future. And I think that's really the most significant thing for today. This is a turning point. This is a day that we've been waiting for a very long time. As has been mentioned, one of our most vulnerable populations would be our residents in our long-term care homes. And those residents are generally seniors and have contributed tremendously to our community over the many years that they've been here. And the vulnerability at this point is tremendous. And so to be able to start immunizing, to be able to give that vaccine to our frontline workers, the priority population being the long-term care home staff, is a tremendous honor, and we're very, very grateful for the residents that we serve in our long-term care homes. It's not only hope, but I think a little bit of relief as far as, we've gotten to this point. It's been mentioned, the devastation that we've seen in some of our long-term care homes across the city and across the province. And we don't want that to continue. It can't continue. And so we're just excited for today. And I really want to thank Thunder Bay Regional Health Sciences Centre for their leadership in getting us to this point to be able to have the vaccine administered, to the Thunder Bay District Health Unit for their constant and ongoing tireless work, obviously the provincial and the federal governments for getting us to this point. I think that we have nothing but gratitude, and in this season of Christmas time, and it seems a really good day and a good time to be able to be grateful and to say thank you and to look forward to a new year with hope. So thank you very much.
Thank you so much, Tracie. Obviously a collective effort. This pandemic has shed a lot of light on the value of those working the front lines. We've seen ordinary people become heroes. We've seen them put the needs of others before themselves. We've seen them put themselves at risk and accept extraordinary challenges. That is indeed the case for people who work in healthcare, and it's certainly true of those who provide direct care to the most vulnerable people in our community, the residents of long-term care. Now, we can't possibly capture their collective experiences here today, but we are very fortunate to be joined by one such hero today, a personal support worker at Hogarth Riverview Manor, to share his story. He's been a personal support worker for 19 long years and will be the first person in our community to receive the COVID-19 vaccine. Sean Bolton, thank you so much. Please come up and share your story and tell us what this means to you today. Thank you.
Good morning. Like you said, my name is Sean Bolton. I've been a personal support worker for 19 years. 21 if you include all the training and everything I've done. I'm grateful for being vaccinated today after seeing how the outbreak has affected several other homes in the area as well as across the province. It's been quite a challenge. Getting the vaccine today will help me better protect my residents as well as my co-workers, and I'm looking forward to this, just hoping that this will be the great path to a great new year. If an outbreak were to happen in our homes, the vaccine means I'll be able to continue to help my residents as well as be there for my co-workers through the everlasting time that hopefully we're finally going to get over this hump and beat COVID-19 once and for all. I really enjoy being a PSW. I feel like I make a change in their lives, and getting past this hump will make the biggest change in all their lives as well. Thank you.